Always by your side. A practical guide to caring for a spouse with dementia. Caring for a spouse with dementia can be a challenging and emotional journey. As the caregiver, you may feel overwhelmed, stressed, and worried about providing the best possible care for your loved one. Dementia is a progressive disease that affects memory, thinking, and behavior, making it difficult for your spouse to perform everyday tasks. However, with the right guidance and support, caring for a spouse with dementia can be a rewarding experience. In this post, we will provide you with practical advice and helpful tips to help you care for your spouse with dementia. From understanding the disease and its symptoms to creating a supportive environment and managing behaviors, this guide will help you navigate through the challenges of caregiving and provide the best care possible for your loved one. 1. Understanding dementia. Dementia is a broad term that refers to a range of symptoms often associated with the decline in memory, thinking, and cognitive function. This decline can affect daily life and the ability to live independently. It is important to understand that dementia is not a normal part of aging, and it is not just about forgetting things from time to time. Dementia can be caused by several factors, including Alzheimer's disease, stroke, Parkinson's disease, and other medical conditions. Depending on the cause and severity, the symptoms of dementia can vary widely from person to person. Common symptoms include memory loss, difficulty communicating, confusion, changes in mood and behavior, and a decline in problem-solving skills. It is important to note that dementia can be a progressive condition and can be emotionally challenging for both the person experiencing it and their caregivers. However, with proper understanding, care, and support, it is possible to maintain a good quality of life and help your loved one live with dignity and respect. 2. The importance of communication. When it comes to caring for a spouse with dementia, communication is key. As the disease progresses, communication can become more challenging, but it's important to find ways to continue to communicate with your loved one. One important aspect of communication is active listening. It's important to listen to your loved one and try to understand their needs, even if they can't always express them clearly. Pay attention to their body language, tone of voice, and other cues to help understand what they are trying to communicate. Another key aspect of communication is being patient. Dementia can cause confusion, memory loss, and other cognitive difficulties, which can make it frustrating for both the caregiver and the person with dementia. It's important to remain patient and calm when communicating, even if it takes longer to get the message across. As the disease progresses, you may need to adjust your communication style. For example, you may need to use simpler language or visual aids to help your loved one understand. It's also important to remain positive and reassuring, and to avoid arguing or correcting your loved one if they become confused or agitated. Finally, it's important to communicate with other caregivers, healthcare professionals, and family members. Keeping everyone informed can help ensure that your loved one receives the best possible care and support. By prioritizing communication, you can help ensure that your loved one with dementia feels heard, understood, and supported throughout the caregiving journey. 3. How dementia affects the spouse-caregiver relationship. Dementia can have a significant impact on the spouse-caregiver relationship. As the disease progresses, the spouse with dementia may experience changes in their personality and behavior, which can be difficult for their partner to cope with. They may become more irritable or agitated, exhibit mood swings, and become less able to communicate effectively. This can cause frustration and stress for the caregiver, who may feel helpless and overwhelmed. In addition to the emotional toll, caregiving for a spouse with dementia can also take a physical toll on the caregiver. They may experience fatigue, sleep disturbances, and other health problems as a result of the demands of caregiving. It's important for caregivers to take care of themselves and seek support when needed. It's also important for the caregiver to maintain a strong support system outside of the relationship. This can include family members, friends, and support groups for caregivers. Being able to talk with others who are going through similar experiences can provide much-needed emotional support and practical advice. Finally, it's essential for the spouse with dementia to receive professional care and support. This can include medication management, therapy, and other treatments to help manage their symptoms and improve their quality of life. By working together and seeking support from others, spouses can navigate the challenges of dementia caregiving and maintain a strong, loving relationship. 4. Tips for daily living, personal care, nutrition, and exercise. When caring for a spouse with dementia, it's important to focus on their personal care, nutrition, and exercise needs. These are the basic necessities of daily living and can have a significant impact on their quality of life. Personal care is important for maintaining hygiene, preventing infections, and promoting a sense of self-worth. This includes things like bathing, grooming, and dressing. It's important to maintain a routine and make these activities as comfortable and enjoyable as possible for your spouse. Nutrition is another key factor in maintaining overall health and well-being. People with dementia may have difficulty eating or forget to eat altogether. It's important to offer healthy, nutritious meals and snacks throughout the day, and to make sure they are eating enough. If your spouse has difficulty eating or swallowing, consult with a healthcare professional for guidance and support. Exercise is also important for maintaining physical health and cognitive function. It can help alleviate symptoms of depression and anxiety, improve sleep, and promote overall well-being. Encourage your spouse to engage in physical activities they enjoy, such as walking or gentle stretching exercises. If your spouse has mobility issues, consider working with a physical therapist to develop a safe and effective exercise routine. By focusing on these basic needs, you can help your spouse with dementia maintain their independence, dignity, and quality of life. Remember to be patient, understanding, and compassionate, and seek help from healthcare professionals or support groups when needed. 5. Creating a safe living environment. Creating a safe living environment is crucial for a spouse with dementia. It's important to ensure that their living space is free of obstacles and hazards that could cause them harm. This can include removing or securing loose rugs, ensuring that electrical cords are safely tucked away, and installing handrails in areas where your spouse may need extra support. You may also want to consider installing locks or alarms on doors and windows to prevent your spouse from wandering off or getting lost. Additionally, labeling important items and keeping them in easily accessible places can help your spouse navigate their living space more easily. Another important aspect of creating a safe living environment is ensuring that your spouse's medications are stored securely and administered correctly. This may involve setting up a medication schedule or even hiring a professional caregiver to assist with medication management. It's also important to create a comforting and familiar living environment for your spouse. This can include decorating their living space with personal items such as family photos and mementos, and playing familiar music or movies that they enjoy. By taking the time to create a safe and comfortable living environment for your spouse with dementia, you can help them maintain a sense of independence and dignity while also providing them with the care and support they need. 6. Managing challenging behaviors. Caring for a spouse with dementia can be a challenging experience. One of the most difficult aspects of caring for a loved one with dementia is managing challenging behaviors, such as aggression, wandering, and confusion. These behaviors are often caused by the person's inability to communicate effectively or understand their surroundings. To manage challenging behaviors, it's important to understand the underlying causes. For example, if your spouse is prone to wandering, it may be because they are trying to find something or someone. In this case, you can try to redirect their attention or provide them with a task that will occupy their mind. Aggression, on the other hand, can be caused by frustration or fear. If your spouse becomes agitated, try to remain calm and avoid arguing with them. You can also try to distract them with a familiar activity or object. Confusion is also a common issue for those with dementia. To help manage confusion, try to keep a consistent routine and environment. This can help your spouse feel more secure and less confused. It's also important to seek professional help if you're struggling to manage your spouse's challenging behaviors. A healthcare professional or counselor may be able to provide you with additional strategies and support. Remember to take care of yourself as well and seek emotional support when needed. Caring for a spouse with dementia can be overwhelming, but with the right strategies and support, you can provide your loved one with the care they need. 7. Finding support. Resources for caregivers. Caring for a spouse with dementia can be a challenging and lonely experience. It's important to remember that you are not alone and that there are resources available for caregivers. One of the first places to start is with your doctor or healthcare provider. They can provide information and advice on caring for your spouse and may be able to refer you to local support groups or organizations. In addition, there are many online resources available for caregivers. Websites such as the Alzheimer's Association and Caregiver Action Network offer information, support groups, and forums where caregivers can connect with others going through similar experiences. Local community organizations may also offer support groups and services for caregivers. Contacting your local area agency on aging or senior center can provide you with information on local resources and programs. Finally, don't be afraid to reach out to family and friends for support. They may be able to offer emotional support, respite care, or assistance with daily tasks. Remember, caring for a spouse with dementia is a difficult journey, but with the right resources and support, you can provide the best care for your loved one while also taking care of yourself. 8. Coping strategies for caregiver stress and burnout. Caring for a spouse with dementia can be a challenging and demanding task. It can take a toll on the caregiver's physical, mental, and emotional well-being, leading to stress and burnout. To prevent caregiver stress and burnout, it is important to have coping strategies in place. One of the most important things a caregiver can do is to take care of themselves. This means getting enough rest, eating a healthy diet, and exercising regularly. It's also important to take breaks from caregiving and to engage in activities that bring joy and relaxation. Support groups for caregivers can be a great source of comfort and help. They offer a safe space to express feelings, share experiences, and receive advice from others who are going through a similar situation. It's important to remember that seeking professional help is not a sign of weakness. In fact, it's a sign of strength and a willingness to take care of oneself in order to provide the best care possible for the loved one with dementia. Professional help can come in the form of therapy or counseling, or even hiring additional help to assist with caregiving duties. Lastly, it's important to stay positive and to focus on the moments of joy and connection with the loved one with dementia. While the journey can be challenging, it can also be a time of growth and deeper understanding of the power of love and companionship. 9. Planning for the future. Legal and financial considerations. Planning for the future is an important consideration when caring for a spouse with dementia. It's important to start thinking about legal and financial considerations early on in the caregiving process. One of the first steps is to create a will or update an existing one. This ensures that your spouse's wishes are respected when it comes to distributing their assets. It's also important to name a power of attorney for both financial and healthcare decisions, in case your spouse is no longer able to make these decisions on their own. Another important step is to create a living will, also known as an advance directive. This outlines your spouse's wishes for medical treatment if they become unable to make decisions for themselves. It's important to discuss these wishes with your spouse and their healthcare provider to ensure everyone is on the same page. In terms of financial considerations, it's important to review your spouse's insurance policies, including health, life, and long-term care insurance. You may also want to consider setting up a trust or other financial planning options to ensure your spouse's financial needs are taken care of in the future. It's important to seek advice from a qualified attorney or financial planner who has experience in dealing with dementia patients and their unique legal and financial needs. Planning for the future can be a difficult task, but it is essential in ensuring that your spouse's wishes are respected and that they receive the care and support they need. 10. Finding joy in caregiving. Celebrating small victories and cherishing moments together. Caring for a spouse with dementia is a challenging task that can often feel overwhelming. However, finding joy in caregiving is essential for both you and your loved one. Celebrating small victories and cherishing moments together can help to reduce stress, improve your relationship, and create positive memories. Small victories can be anything from a moment of clarity, a positive interaction, or a simple task completed successfully. Acknowledging and celebrating these small wins can help to boost your loved one's confidence, provide a sense of achievement, and improve their overall mood. It can also give you a sense of accomplishment and help to maintain a positive outlook on the caregiving journey. In addition to celebrating small victories, cherishing moments together can also bring joy to caregiving. These moments can be as simple as sharing a cup of tea, listening to music together, or enjoying a walk outside. Take the time to create meaningful experiences with your loved one and focus on the present moment. These moments can create lasting memories that you can look back on with fondness. Remember to take care of yourself and find joy in caregiving. Celebrating small victories and cherishing moments together can help to make the journey of caring for a spouse with dementia a more positive experience. We hope that you found our practical guide on caring for a spouse with dementia helpful. Dementia can be a challenging and overwhelming condition to manage, but with the right approach and mindset, it is possible to provide quality care for your spouse. Remember to take care of yourself as well and seek support from family, friends, or professional caregivers if needed. We hope that you will be able to use the tips provided in our post to make your caregiving journey a little bit easier. Our thoughts are with you and your spouse during this difficult time.